Hi, everyone. Welcome to PTA 105 Tests and Measurements. This is one of the first hands-on practical courses that you'll take in the PTA program. Definitely not the last, though. And I'm excited to be with you on this journey through the next quarter. So, as a licensed physical therapist assistant, I have extensive clinical experience across multiple settings. I've worked in outpatient orthopedic clinics, acute care hospitals, skilled nursing facilities, and outpatient neuro clinics. More importantly, though, I am passionate about developing the next generation of skilled PTAs, of which you will be a part. So I've seen firsthand how the skills that we're going to learn in this course make the difference between adequate care and exceptional patient outcomes. This course is where theory meets practice. So last quarter, we learned bony landmarks. So we did have hands-on, definitely. Learned a lot of theory about movement, but now we're going to put it into practice. Why do we need to know where those bony landmarks are? Well, now we'll figure that out. So it isn't just about memorizing facts. It's about developing hands-on skills. And it's the skills that are going to make you a competent and confident PTA. So you'll learn to perform goniometry, and other types of range of motion measurements, manual muscle testing, sensory and reflex testing, and posture assessment, as well as workstation ergonomics. All of these are fundamental skills that physical therapists rely on PTAs to perform accurately and safely. So you can think of this course as starting your toolkit. Every technique we learn is a tool that you'll carry with you through all the rest of the courses in the program and throughout your career. When whether you're working in an outpatient clinic or hospital or a skilled nursing facility, these assessment skills will be part of your daily routine. I remember when one of my classmates that I studied with a lot when I was and was worked with in lab a lot while I was in the program. Several years later, we were talking, and she said, "Remember how much we worried about practical exams for goniometry, and now it's like nothing, like we do it every day." So you'll learn these skills and you'll do them so much that they will just become nothing. They'll just be part of your daily practice. So over the next 8 weeks, we're going to cover four major areas. So we'll spend 2 weeks on each area. Weeks 1 and 2 is goniometry, and we'll start with measuring joint range of motion using goniometers. We're going to review end feels that we talked about last quarter. You'll learn proper positioning and measurement techniques and how to document your findings accurately. So this is foundational. Nearly every patient you work with will need range of motion assessments. So you need to know how to do this. Manual muscle testing, weeks 3 to 4, we're going to assess muscle strength using a standardized manual muscle testing technique or group of techniques. You'll learn the proper grading of muscle strength, positioning, and resistance techniques that ensure reliable and consistent results. So that's important. You have to use consistent, evidence-based techniques in order to get reliable and consistent results. In weeks 5 and 6, we'll talk about sensory and reflex testing, which is fun and interesting. We'll explore how to assess sensation and reflexes and neurological responses. This includes dermatome and myotome testing, which are critical skills for understanding orthopedic and neurological conditions. Weeks 7 to 8, we're going to work on posture assessment. We're going to learn to analyze static and dynamic posture, identifying deviations and understanding their clinical significance. So the first contact you have with the patient when you're in the clinic, you say that you're in an outpatient clinic. I'm just pretending we're in an outpatient clinic. We walk out into the lobby to get the patient who's there for their appointment. And the first thing you notice is their posture. How are they sitting in that chair? Are they even sitting? Are they standing up? Because their back hurts too much when they sit or something like that. So right away, posture, you get a visual what's going on with the patient. So our learning objectives for this course, By the end of the course, you should be able to explain the clinical significance of each test and measurement that we cover. You should understand your role as a PTA in the assessment process because we're not doing initial evaluations. We're usually reassessing things that the PTA has already evaluated, or the PT, excuse me. You are going to be able to demonstrate proper technique for each assessment tool. You're also going to need to know how to position patients safely and appropriately for testing and when testing is not appropriate. You are going to learn how to document your findings accurately and communicate them effectively to your other team members. So these aren't just academic goals, these are skills that will make you a valuable member of the rehabilitation team. So that's pretty exciting. This is a hybrid course, just like kinesiology was last year. So we're going to combine the flexibility of online learning with the essential hands-on lab experiences that you will need to really learn these techniques. So the online components are going to be short lectures and theory delivered through Canvas and some videos and theory delivered through PhysioU. And I'm going to just show you a little orientation of PhysioU in this video. The I'm going to have the modules, so it'll be 4 modules, one for each of 2 weeks, and they will open the Saturday preceding the next module. That makes sense. So, and the assignments are typically going to be due the following Saturday at 11:59 p.m. before you turn into a pumpkin. So, you're going to have interactive physio use simulations for practice, and some of them will be assessments. So, I'll talk about which ones are going to be assessments. The in-person labs are required. We're going to have 3 mandatory lab sessions all on Mondays after your Saturday and Sunday PTA 110 labs. So hopefully y'all won't be too tired after those 2 days. But you get to lie down and be a patient part of the time and then be the therapist the other part of the time. So July 14th is our first lab, Monday lab, and we're going to be working on goniometry skills and an introduction to manual muscle testing. The Whatcom lab you will have with me, and the Pierce lab you'll have with Claudia, like we did for PTA 202. The second lab is going to be August 4th. You're going to have skill checks for goniometry, and it's going to be not the same as, but similar to practicals in 202, where you pick two goniometry measurements that you're going to be evaluated on. So you're not going to be evaluated on every single one of them, but you will pick 2 of them that you will be evaluated on, randomly. And then the rest is after the goniometry skills check, the rest of the lab will do manual muscle testing assessment. On August 18th, we're going to do final skills checks for manual muscle testing and a comprehensive review. And we will be doing sensory and sensory testing and posture. So with sensory testing and posture, you're going to have skills checks, but they will be less formal than the manual muscle testing skills checks and the goniometry skills checks. You won't have to pick one out. I will just walk around in the lab while you're working on things and see how you're doing. So kind of an informal skills check. And that's the time to get your questions answered. So our essential resources, our required materials, our PhysioU subscription, and this is going to be valuable in a lot of your other classes as well. So not just this class. So it's like buying several textbooks, if you want to think of it that way, with videos. So that's nice. You have your goniometers and your tape measures that we handed out in the last lab in 202 at the end of spring quarter. You should make sure you have appropriate lab clothing. We are going to have to see, touch, and measure landmarks. So you should be wearing shorts and tank tops. Sports bras are acceptable. Your classmates have to be able to get to your landmarks not through clothes. So as you know, it can sometimes be cold in the lab or hot in the lab. So bring layers so you can be comfortable when you're not being measured, but be ready to have the appropriate clothing when you are being measured. The textbook, the Physio U is going to be our primary resource. Clarkson's Musculoskeletal Assessment is a really good reference book. In your lab manual, you also have reference charts and tables for all of the measurements, so you'll have that. I will have copies of Clarkson in the lab for you to refer to if you want to refer to them when you're in the lab if you decided not to buy that. Your kinesiology text might also be helpful, as well as your trail guide for the body for finding those landmarks. So you got to find the landmarks in order to measure. That's why we were so big on landmarks in the first quarter. So the assessment and grading, you're going to have two 45-point skill checks, um, two mini exams, quizzes, whatever you want to call them. And you're going to have four assignments that are, where you have to do a video or something like that. And then you're going to have one comprehensive final, which will include everything. And that's going to just bring everything together. All of the testing is going to be online. So that should be straightforward, I hope. You have to get, just like every other class, you have to get 74% on written exams. And it's a program requirement. It's designed to ensure that you're ready for taking your licensing exams. So the things that you need to know: lab attendance is mandatory, no exceptions. If you miss more than 10% of any component, it might put you onto probation. Probation is not a good place to be. You don't want to be there. If you're more than 20 minutes late to a lab, which none of you are going to be, but if you're more than 20 minutes late to the lab, you'll be marked as absent. That's not good. So don't do it. And you'll already be there because you'll be there for the 110 labs. So there's you won't be late for those Monday labs. Just don't do it. Just don't be late. Be on time. In terms of assignments, late is also not good. Except in extreme circumstances. Like, this is a good example of an extreme circumstance. Last year, one of the students in lab, her house burned down the week before lab. You know what? She got her lab work in on time. So but I would have considered that an extenuating circumstance to qualify her for late work. But anyway, if you are if you need to turn in one assignment late, you can arrange one late assignment this quarter if you notify me at least 24 hours in advance. Like, say your house burned down or whatever. God forbid, but let me know in advance one time. You get like one grace period. Plan your schedule around your coursework, not the other way around. So you have three classes this summer. This one's only 2 credits. Um, so it's doable without taking up your whole life. So in terms of professional behavior, coming to lab prepared and on time, that's professional behavior. It's the same thing when you show up in the clinic. You want to show up in the clinic prepared and on time. You want to participate actively in all the lab activities. That's what you go to lab for, so why wouldn't you do that? You want to maintain professional communication in all interactions, and you want to respect your classmates during hands-on practice, making sure you're using appropriate professional touch and getting consent before you do it. So set your expectations this summer for success. Summer quarter moves fast, and time management is really important in summer quarter. 8 weeks instead of 11 or 12 in the other quarters. So you'll need to stay organized and keep up with the pace of the class. I recommend logging into Canvas at least twice per week to stay current with not just the assignments in this class, but all your assignments in all the other classes. And if you haven't figured out how to use the Canvas calendar yet, it can be pretty handy for showing all your assignments for all your classes all in one place. So this is hands-on learning. So be prepared to practice on each other during the labs. You will need to practice on other people too, whether you work in a clinic or not. Practice on your friends and family. So In lab, you have to be comfortable with appropriate professional touch and being respectful of other people's boundaries. So we're creating a safe, supportive learning environment where everyone can develop their skills. And I think we've really, both lab groups have really bonded over the last quarter, and I think we're going to do great with this. It's going to be a lot of fun, actually. Um, you want to have a growth mindset with all of in life, but particularly in the educational sphere. Some of these techniques will feel awkward at first. Adult learners hate to make mistakes. I know you, I know how you are. You hate making those mistakes. And when stuff feels awkward, it's weird, but it's completely normal. You have to go out of your comfort zone. So I saw this little sticker and it was online. I didn't buy it, but maybe I'll get my sister to make me one. She makes stickers, but um, it said to learn, find your comfort zone and then step out of it. And I thought, wow, that's great. We got to get out of that comfort zone. So when you first start doing, like I was saying with my former classmate who said, remember how much we used to worry about goniometry and now it's like nothing because we've practiced. So things feel awkward at first and then you practice and they feel easier. So it doesn't get easier, you just get better at doing it. So every skilled PTA started where you are now. So embrace the learning process, ask questions, don't be afraid to make mistakes in the lab setting. That's what the lab is for. So make your mistakes in lab. And then by the time you get to clinicals, you'll be solid. So you know that you can reach me through the Canvas inbox. That's usually the fastest response time because I see it sooner. Through my Watcom email. If there's a question that might be helpful to other students, post it to the Ask Loretta board. We haven't used it that much. We didn't use it that much in 202, but that is a good place for sharing information. The virtual office hours are going to be 6:30 to 7:30 on Tuesdays. It's a shared office hour between this course and 273, which is the other course you have with me. So you might not have any questions for this course, but you might have a lot of questions for that, or vice versa. I'm in class Tuesday, Wednesday, Thursday. So when I'm in on Wednesdays, I'm in lab all day long, and some of the things we do are field trips, and so I won't be checking messages on Wednesdays until the end of the day. On Tuesdays and Thursdays, I'm just there in the morning. But just know that when I'm in class and in lab with you all on Monday, I'm not checking my messages every 5 minutes. So it might take a little bit longer for me to get back to you, but I will. I'll always get back to you. I'm trying to be disciplined with myself and not answer questions on the weekends. You know that I do, but if I don't, who knows? Maybe I went somewhere. And I'll answer your weekend questions on Monday, but hold me to that, will you? So, in terms of getting help, if you are, don't wait until you are struggling to reach out. Reach out early if you need clarification, extra practice, or support with any aspect of the course or the program. So I am here to facilitate your learning. I'm not here to give you impossible tasks. So reach out when you need help. I'm here to help you. Your professional development is really what we're working on in this class. You're not just learning techniques, you're developing your skills as a healthcare professional. So, this course will help you build confidence in your clinical skills and understand the reason why we do each assessment and when it's appropriate to do each assessment. You're going to work on developing your professional communication skills, and you're going to learn to work effectively as part of a healthcare team. That is an important part. Every measurement you take, every assessment you perform will directly impact patient care. And that's the responsibility and privilege of being a PTA. So, as we start out working through this together, I want you to know that I'm here to support your success. If the course is challenging, it's also incredibly rewarding. So, by the end of the course, by the end of this really quick summer, um, we will spend time together developing a solid foundation in physical therapy assessment skills that will serve you throughout your career. Take a moment to review the syllabus. We're going to look at Physio U, and if you haven't already set up a Physio U account, now's the time. Set that up and join the cohort. You'll get an email in your Watcom email from me and an invitation for joining the cohort. When you join the cohort, it allows you to easily turn in assignments with no extra effort on your part, which is really kind of nice. Mark those lab dates on your calendar. Make sure you know which dates you're coming. First module opens this Saturday or this Monday, June 30th. We're not allowed to open it earlier than the start of the quarter, but the welcome part is open. We'll dive right into goniometry with the first module. So before we wrap up, I'm going to go through Physio U, but remember, if you have any questions about the course structure, the policies, or the expectations, be sure to contact me for clarification. No questions too small. I'd rather address concerns now than have confusion later. So for the first lab session, complete the Physio U goniometry preparation modules and come ready to learn. And in fact, our first assignment is a goniometry assignment. You're going to choose one goniometric measurement, and you're going to do a video of yourself performing it on someone, and you're going to submit that video, and that's before lab. So the first thing that you have to do in the first week before July 3rd is you have to post to a discussion board choosing the measurement that you want to do. It's first come, first serve. Not everybody can pick the same measurement. The list of measurements that you can pick from are in the assignment, but that's something that you have to do right away in the first week. And then in the second week, you have to make the video and submit it, and that's all before the first lab. In the lab, we will also be recording you so you can evaluate yourself. So that's kind of nice. So I really am looking forward to working with you on this clinical information and watching you develop into skilled and confident PTAs. So let's make this an excellent experience, and let's look at Physio U just to get an idea of what we're in for with that. So when you log into Physio U, your screen may look a little different from mine because mine's the educator screen and yours is a little bit different. So I have an educator dashboard and I have you all listed in there, and I can look at all the modules that you've turned in. And you'll have a student dashboard, which will have all the assignments, which is kind of nice. So on the orange side is applications, and on the blue side is e-learning and simulations. So your assignments that you'll be submitting, basically submitting through Physio U, will be on the blue side. And so when we look at there's so much in Physio U, you can get lost in there. But range of motion, manual muscle testing, and palpation, and special tests are the two on the orange side that we're mostly going to be looking at. On the blue side, we're mostly going to be looking at range of motion and manual muscle testing simulations and posture simulations. So what I suggest for going through the material in Physio U, it's not like a book where you can just flip through the book. But if you click on this, it has like, oh, look at that, all those body parts. What I suggest you do is take your lab manual and look in the goniometry section, which is the first section, and look at we're going to be looking at end feel again. So in each of these sections, it has, so when you say like, oh, shoulder, head and neck, elbow. So I'm just going to click on the knee section just for the heck of it. If you look in the lab manual, it has a list of all the measurements we're going to do. What I suggest is you take this list and you say, okay, today I'm going to do the first two or the first three, however many you want to do. and I'm going to go through and I'm going to look at that. So let's just say on my list today, it was knee. And so I'm going to look at this list, and palpation shows videos how to find different landmarks, bony landmarks and muscle landmarks, soft tissue landmarks. The range of motion shows end feel, assessing end feel and what our normal end feels are. And then the measurement. So with knee, of course, we just have flexion and extension. That makes it easy. So you'll go in and it has a little video. This is like a minute long. They're between 30 seconds to 2 minutes long. So nice short videos that just show you how to assess end feel. And then they tell you what the normal end feel is. I'm like, oh, that's great. I'll go back to that. So then I'm going to go to knee flexion. I'm going to watch the 1 minute video on measuring knee flexion with the goniometer. It talks about the position, the normal end feel, what the landmarks are, the normal ranges of motion. And note, there are two different sources, and the normal range of motion is different from the two different sources. So in one of the assessments, I might ask you, according to the American Academy of Orthopedic Surgeons, what's the normal range of motion for knee flexion? You would say 135. So it has what functional activities you might need more knee flexion for. You know what I didn't put here is getting in and out of the bathtub. You need some functional knee flexion for that. I hear that from people all the time. And then I'm going to go and say, okay, knee extension, see how to measure that, look at my landmarks, take any notes that you want to take in your lab manual. That's a good place to take them. Once you've done that, you can go right to the simulations. And what I'm going to have you do for your assignment is you're going to pick 3 of the simulations that is not the one that you picked for your project. So say that you picked a knee flexion for your project. You're going to measure one of these. You're going to do one of these other simulations. Actually, you're going to do 3 of them. So not knee though, because you did knee for your project. So maybe I'm going to pick hip and shoulder and wrist and do those. And those will be automatically submitted when you do the simulations in PhysioU. With the special tests, there's a lot more than we're going to be doing in this class. So when you look at, let's look at the knee again, what the heck, there's a ton of stuff in there. There's balance, there's joint mobility. That's what we're going to be talking about. The patellofemoral dysfunction we talked about last quarter, but so there are lots of different tests that we're looking at. If you look at all the tests, it lists every single one. We're not doing every single one in this class. Some of these you'll be doing in your orthopedics class. Some of the manual muscle testing is in here. Flexibility testing is in here. The reflex testing we will be doing in this class. But you'll see there are tons of tests. We're not going to do them all this quarter. In fact, we're going to do very few of them. But you can just take a look there and pick which test you want to test, which tests you want to see. So, wow, look at all those knee tests. So there's not very much in terms of range of motion, but there's tons of tests that you can do orthopedically for knees. So pretty interesting. There's so much information in PhysioU, you'll never look at it all. But on your student dashboard, when you join the cohort, you'll have the simulations that I recommend you do. So hopefully you'll find that useful. If you have any questions about PhysioU, let's talk about them and figure it out. It's a really good resource, not only for all your classes, but for studying for your board exams. All right, let's have a great quarter. I'm looking forward to it. See you soon.